Cuban authorities have responded to a terrorist attack on the Cuban embassy in the United States. According to a new poll, some 14% of adults in the United States would forego medical care for COVID-19 symptoms because they can't pay for it. With almost 40,000 confirmed coronavirus cases across the African continent, the WHO has called for African nations to gradually lift coronavirus measures in line with the evidence on the continued risks. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. In the early hours of this Thursday, an unknown individual fired at the building of the Cuban embassy in the United States. The mission's personnel are safe and protected. However, there was material damage to the building resulting from the impact of the shots. An individual whose identity the Cuban government has received no information about was detained by local authorities at the scene and placed in custody. The Cuban diplomatic mission located in Washington, D.C. has a protection and security system in place to deal with any threat against its personnel and facilities. Cuban Foreign Minister Bruno Rodriguez offered statements this Thursday afternoon on the terrorist attack.
I also expressed my surprise regarding more than 12 hours after the aggression on our embassy, and that the authorities of the U.S. and of the State Department had not contacted us. There are no official statements, not even a tweet that are so frequent speaking of Cuba on behalf of officials of the United States. I have also called on the State Department to take upon promptly all of the measures that are necessary to go through with all of the responsibility that the Vienna Convention implies, and to guarantee the permanent mission in United Nations New York and the headquarters in Washington, as well as all of the people and relatives that are in this mission.
In Colombia, the Regional Indigenous Council of Cauca has condemned the recent violent events in the indigenous community of Tortugueros. This Thursday afternoon, the Indigenous Council released a statement condemning the invasion of the territory by armed individuals who are using the coronavirus health crisis as an excuse to undertake violent acts. The Council also called on human rights organisations and government representatives to act to stop the abuses against indigenous communities. Following the examples of Rio de Janeiro, Amazonas and Sao Paulo, the Brazilian state of Pernambuco is set to extend its coronavirus restrictions. According to a decree issued by Pernambuco State Governor Paulo Camara, stay-at-home guidelines will remain in force until at least May 15th. As of Wednesday, the impoverished northeastern state has confirmed over 6,000 COVID-19 cases and more than 500 deaths. Its hospital system has collapsed under the pressure. Meanwhile, Rio de Janeiro, which has been bankrupt since the 2016 Olympics, is expected to be the next Brazilian city to see its hospital system collapse. Its world-famous Copacabana neighborhood has reported the highest number of coronavirus deaths, as it has the highest elderly population in Brazil and is also the densest urban area in the Western Hemisphere, with 35,000 residents per square kilometre. The number of coronavirus cases continues to rise in the Latin American region. Brazil remains the worst-hit country with close to 80,000 positive cases and more than 5,500 deaths. It is closely followed by Peru with almost 34,000 cases and more than 900 fatalities. Meanwhile, Ecuador, ranked third in the region, has officially reported over 24,600 positive cases and more than 800 deaths, but the real numbers are thought to be much higher. Mexico and Chile rank 4th and 5th on the list of worst-hit Latin American countries. Jamaica's Prime Minister Andrew Holness announced on Thursday the establishment of a cabinet-approved multi-sectoral task force to oversee the island's economic recovery from the novel coronavirus.
Over time, the testing protocol will have to be adjusted, and so one of the things we're looking at now is antibody testing, and that will be introduced, particularly as you open up. which is a different type of testing to look now at the antibodies, which means the exposure level of the individual and by extension the population to the virus.
The number of confirmed COVID-19 cases and fatalities continues to rise in the Caribbean. The Dominican Republic remains the worst hit nation in the region. It is followed by Cuba with 1,501 positive cases and 61 fatalities. Meanwhile, Jamaica has reported a total of 396 cases and 7 deaths. They're followed by Martinique, Guadeloupe and Trinidad and Tobago as the countries with the highest number of cases reported in the region. And the Senate of the Dominican Republic unanimously approved the extension of the state of emergency decreed in March to combat COVID-19 for a further 17 days. The extension period will begin on May 1st. The Dominican Republic has reported 6,972 coronavirus cases and 301 deaths. More stories coming up after this very short break, so don't go away. Welcome back to From the South. The International Labour Organization has warned that around half of the world's workforce is at immediate risk of losing their livelihoods due to the economic impact of the coronavirus pandemic. In its latest report, the UN agency stated that those hardest hit by the pandemic have been informal sector workers, the self-employed, and those on short-term contracts. According to the ILO, the deepening crisis in many parts of the world has left more than 400 million businesses facing financial hardship and possible closure, which will inevitably impact on workers. The report listed the worst hit sectors as manufacturing, accommodation and food services, wholesale and retail trade, and real estate. Since the novel coronavirus emerged in China at the end of 2019, drastic lockdowns to limit its spread have taken a dire toll on the global economy and left millions jobless. Some 14% of adults in the United States would forego medical care for COVID-19 symptoms because they can't pay for it, according to a new poll. According to a Gallup poll published on Tuesday, 1 in 7 American adults would avoid seeking health care if they or a family member experienced symptoms of COVID-19 out of concern they would be unable to afford treatment. Even if they specifically believe themselves to be infected with the coronavirus, 9% of those surveyed said they would forego care for financial reasons. Some 55% of people in the US receive healthcare through their jobs. At least 30 million have filed for unemployment in the last 5 weeks, meaning an unprecedented number of families are now uninsured should they need medical care. Even those lucky enough to have kept their jobs and insurance could face steep co-pays or other surprise costs should they fall ill. Russian Prime Minister Mikhail Mishustin has self-isolated after testing positive for the coronavirus. The news was announced on Thursday evening live on national television during a video link with President Vladimir Putin. First Deputy Prime Minister Andrei Belousov will step in as interim head of government during Mishustin's recovery. Earlier in the day, Mishustin headed a governmental session conducted remotely. His diagnosis makes him the second major world leader known to have contracted the infection after British Prime Minister Boris Johnson. Meanwhile, Russia reported 7,099 new cases of the coronavirus on Thursday, a record daily rise, bringing a total to over 106,000. As Germany prepares to ease more coronavirus curbs, with museums, zoos, memorials and botanical gardens set to reopen, Chancellor Angela Merkel's Chief of Staff said on Thursday that social distancing measures would certainly be extended until May 10th. Germany has seen more than 163,000 COVID-19 cases.
This virus is in our country. It will be in our country for months. That is why we have to live for months in this so-called new normality, where we have to make sure that the virus has a little chance as possible of spreading further. And that will continue to be the case as things stand at the moment, until we either have a vaccine that will give us the immunity we need when we are vaccinated and have a good vaccine, or when we have better medicines that will allow us to treat the infected better, faster.
Health authorities in Spain have announced time slots for specific outdoor activities to avoid confusion and further coronavirus infection. Adults will be allowed out to exercise on Saturday for the first time since mid-March. The overall death toll in Spain rose to over 24,000 on Thursday, while the number of cases has surpassed 239,000.
It is a good evolution, but we must analyze it with a lot of caution. Not so much because there may be a step back in some moment, but because it could lead to some euphoria that could generate problems in the future. I can say that psychologically it is wonderful to be able to hug everyone you can, but we must understand that this is a risky situation. The risk will not last forever. We will be able to hug when we be allowed to. I think that right now, in our situation, with the levels of transmission we have seen in Spain and with the epidemic that we have gone through, we must be conscious of the risk that this entails, not just for the child, but for their own grandparents.
Italy has registered almost 28,000 COVID-19 deaths, the highest number in Europe, and has introduced some of the toughest lockdown measures in the world, which looks certain to tip its fragile economy into a deep recession. Prime Minister Giuseppe Conte announced on Thursday that some Italian regions might be able to roll back coronavirus restrictions more rapidly than others, but warned local authorities against acting unilaterally.
We will also be able to agree with the regions, with the autonomous provinces, to relax the restrictive measures on a territorial basis, so as to take account of regions where the epidemiological situation seems less critical. In this way, we will be able to establish geographical differentiation even in this phase of relaxing the measures with the reopening of activities on the basis of a plan based on precise scientific data.
A British cabinet minister has admitted that the UK is on track to miss its target of carrying out 100,000 coronavirus tests a day by the end of April. The news comes after the United Kingdom jumped to second place in Europe in terms of the number of COVID-19 fatalities on Wednesday, taking over France and Spain after health officials finally included people who died in care homes and the wider community in the official figures. British Health Secretary Matt Hancock set the goal at the beginning of the month, but as April draws to a close, only around half the number of tests were completed by Wednesday, raising further questions about the UK government's mishandling of the crisis. According to the Korea Centers for Disease Control and Prevention, this Thursday South Korea reported no new domestic coronavirus cases for the first time since February 29th. The country at one point had the largest outbreak outside of China, where the disease first emerged in December last year, but appears to have brought it under control with an extensive trace, test and treat program. Earlier this month, South Korea became one of the first countries in the world to hold a national election since the coronavirus pandemic began, while many others have postponed votes. On Thursday, South Korea reported just 4 new cases, all of which were imported, taking the total to more than 10,700, while the death toll stands at 247. China's National Health Commission reported 4 new imported COVID-19 cases on Wednesday and no new deaths. 3 suspected cases were reported in Shanghai, all of which were also imported, according to the Commission's daily report. The official figures show that 32 people were discharged from hospital after recovery, while the number of severe cases decreased by 9. The total number of confirmed coronavirus cases in China has surpassed 82,800, ranking the country 10th in the world. 619 patients remain under treatment. And we're taking one last break now, but stay with us for more. Welcome back to From the South. There are now almost 40,000 confirmed coronavirus cases across the African continent. Meanwhile, the death toll has reached over 1,600, meaning it continues to be the least affected continent by the pandemic. Comoros is the African nation with the lowest number of cases, having only confirmed 1 positive case so far. Among the countries with the largest numbers of cases, South Africa ranks first with 5,647, followed by Egypt with 5,537 and Morocco with 4,423 confirmed cases. The World Health Organization's Regional Director for Africa has called for countries like South Africa, Nigeria and Ghana to gradually lift coronavirus measures in line with the evidence on the continued risks.
in balancing lives and livelihoods, countries are now looking at easing restrictions, and in doing so, we're encouraging countries to adjust measures slowly and in line with the evidence. There are now more than 34,000 confirmed cases in Africa, and sadly, 1,500 lives have been lost.
To us, that the 5 weeks that we have will give us a maximal shift in the curve, in the peaking of the curve, that if we were to move the lockdown further by another month or 2 months, it would hardly change that trajectory. A massive testing program has netted about 195,000 tests on individuals, of which the 5,000 are the ones who are positive.
So we have 1,483 active cases which are still under observation. Some of them, most of them are at home or at isolation centers without symptoms. A few have symptoms and they are being managed at a couple of treatment centers.
Over 1,600 doctors from 22 African countries held a video conference with Chinese medical experts this week to exchange views and experience on fighting the ongoing COVID-19 pandemic. 8 Chinese medical experts from the China-Japan Friendship Hospital in Beijing participated, including Wang Chen, a respiratory and critical care specialist and vice president of the Chinese Academy of Medical Sciences. During the conference, they shared 10 key measures China had adopted during the fight against the virus. Meanwhile, John Nekengasong, director of the Africa's Center for Disease Control and Prevention, expressed thanks to China for its timely aid supplied to African countries and noted that they will learn more from how China tackled the pandemic. South Africa reported its biggest daily rise in coronavirus cases on Wednesday at 354, taking a total to over 5,000. Meanwhile, in the midst of the COVID-19 lockdown, gender-based violence has risen across the country.
Now, the coronavirus pandemic heightens the risk of gender-based violence as women may be experiencing emotional and physical abuse behind the walls of their homes. This calls for heightened responsiveness, greater awareness, and practical measures that need to be taken to assist women who find themselves in vulnerable situations as we speak during this lockdown period.
This Thursday, several special flights repatriated hundreds of Egyptian citizens who were stranded outside the country due to the coronavirus pandemic. The flights operated by national airlines transported Egyptians who had been stranded in Nigeria, South Africa and Kenya. They landed in the resort town of Marsa Alam on the Red Sea, where the passengers will be required to remain in quarantine for 14 days, a commitment they all agreed to before boarding the planes. The Iranian Health Ministry reported 71 new COVID-19 fatalities, taking the country's death toll to over 6,000. Iranian officials added that another 983 people tested positive for the virus during the same period, bringing a total to over 94,000. Iran has shut schools, universities, cinemas and stadiums, among other public spaces, since March to contain the spread of the virus. However, since April 11th, it has allowed a phased reopening of its economy and lifted restrictions on intercity travel. Mosques remain closed even as Muslims observe the holy month of Ramadan. Arab foreign ministers strongly condemned Israel's plans to annex parts of the occupied West Bank on Thursday. In a statement followed by a video conference, the Arab League considered the plans a new war crime to be added to the Israeli record full of brutal crimes against the Palestinian people. Israeli Prime Minister Benjamin Netanyahu and his political rival, Benny Gantz, signed a deal on April 20th to form a unity government that could accelerate Netanyahu's plans to annex parts of the West Bank in the coming months. The Arab League called on the US government to abide by the UN Charter and international law with regards to protecting Palestinians' rights and abandoning its support for Israel's plans. April 30th is International Jazz Day, and we finish this news brief with the latest video clip of one of the young stars of Cuban jazz, saxophonist Michelle Herrera, because in the midst of this pandemic and social isolation, music can help save us from feelings of solitude and sadness. Remember, you can get all the latest news on our website as well as on social media. For Telesur English, I'm Katrina Goss. Thank you for watching and enjoy the music.